afternoon. Okay, I see more people coming in. There are a few empty seats here in the front and here on my right. Wow. Okay, if you have empty seat next to you, could you put up your hand? Okay, follow the hand, please. Okay, follow the hands. Empty seat.
Two empty seats.
We have one more here. Yeah. Here in front, second row here. Okay, two seats here on my right and far right there. Follow the hands. Follow the hands, the empty seats. Yeah. And follow the pen. Okay, right. Okay, so it's 12:15. We're going to start now. I hope everybody settle down. Okay, so welcome to the second workshop of ISAM 2014 with a theme on therapy. My name is Aliza Alias. I'm from Faculty of Education UKM and I'm the moderator for this session. Okay, this workshop entitled Social Skills for Children with Autism will be conducted by Ms. Jochebed Isaac. Okay, so I have a short discussion with Jo. So she would like to share. Okay, so her session, this session will be 1 hour. And then we're going to stop at 1:15, no Q&A. Hold on. If you have any question, you can come and see her personally. Or because she wants to share. She has videos, right? Okay, let me read about Jo. Okay, Jochebed Isaac serves as Director of EAP Malaysia. She completed her Master of Clinical Psychology at University Kebangsaan Malaysia and her Bachelor of Psychology at Curtin University of Technology. Jo was trained as a supervisor at the Wisconsin Early Autism Project, United States of America, under the guidance of Dr. Glenn Shellos. She has worked with many children diagnosed with autism spectrum disorder in USA, Australia, Singapore, and Malaysia. And she has also trained parents, therapists, and professionals on a variety of topics in the field of autism. Okay, I won't read the abstract. You can read the abstract in the book, right? Okay, so please, Jo.
Yeah, thank you, Dr. Ajay.
Yeah.
Thank you very much. Good afternoon, everyone. It's so wonderful to see so many people here. I'm just wondering if whether the facilities team could help us get a few more chairs for those who are standing around at the back. I'm sure we can pull some chairs from a different room. Is that possible, if we can get that organized? Great to see so many foreign delegates, fellow colleagues, professionals, parents, ladies and gentlemen. My name is Jochebed Isaacs. That's quite a mouthful, so you can call me Jo, it's much easier. And I'll be presenting a topic which is hard to do in 1 hour. So when I heard that I was given 35 minutes, I was even more like, oh my gosh, that's really not enough time to cover something that we usually take 3 to 6 hours to present on. So I hope I do justice to the topic. We're going to make it quite brief. We're going to run through some of the slides quite quickly. But like Doctor mentioned, I will stay back a bit longer to answer any questions that you have. Now, before we start, I'm just going to play a quick video on what we do at Early Autism Project, which is where I work as the director. In 1943, Leo Kanner discovered autism. Today, 1 in 88 children are affected by autism. The 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, defines autism as a neurological disorder with symptoms presenting in 2 areas: deficits in social communication and social interaction, and restricted, repetitive patterns of behaviors, interests, and activities.
It's this constant denial, and in fact, even after actually knowing, it takes a while for it to really sink in. You know, it was never fun because we were always dealing with them and we were always trying to get them to have fun, and it was so self-condemning whenever they were not having fun. Then you start to really think and ask, what is going on? Because you still try to tell yourself that, you know, he'll be okay. He'll be okay. But it just never became okay.
Early Autism Project provides individualized services for people with autism using the Applied Behavioral Analysis approach, commonly known as ABA. ABA was developed by Dr. Ivan Lovas in the 1970s and till today remains the most effective research-based treatment program for children with autism. ABA basically means to break skills down, to pair learning with positive reinforcement, and to provide children with sufficient practice so that they not only learn the new skills but they're able to retain their skills and generalize them in a natural environment. At EAP, our curriculum is individualized for each child in the following 7 areas: early learner skills, language and communication skills, social skills, play skills, academic and cognitive skills, daily living skills, and generalization of skills.
It's so important for parents to feel you can do it, you can do it.
Surrounding this is a philosophy that is child-centric, empowering, inclusive, partnering, fun, leading, and excellent.
The difference comes. The language springs out. Even started to speak. So to even explain that yes, they were autistic, they are autistic, it was like, which part is autistic again? Yeah. You know, I was talking to my husband, it's so weird, you know. I started looking at my children as a blessing rather than seeing them as a problem.
We believe that we are a place where we have faith, you find hope, and our children are loved. This is us. This is Early Autism Project Malaysia. That video always moves me with that mom sharing her personal journey. I'd just like to take a couple of seconds to introduce to you my team. If you would just stand up, Nisha, Jerusha, Charmaine, and Emma. I'm here with 4 lovely ladies. They're not just young and beautiful, they're also very intelligent. They've got experience with working with children with autism. They each supervise individual ABA programs. So later, when you have questions, you can approach them as well. And thanks again, Doctor, for such a warm welcome. Okay, now I just have one quick disclaimer. I'm actually 10 weeks pregnant. So that's very exciting for me. It's my first pregnancy after working with many children all my life, basically, but now I'm going to have my own. But because of that, I have quite a severe kind of reaction with nausea. And so if I start to look pale or start to be breathless, please kind of just ignore me or give me some space, and then I might sit down and do the rest of the presentation. But yeah, just I thought I should tell you that in case I suddenly faint. Okay, so if we can go to the agenda, which is on slide 2. By the end of today's session, we're going to skip over the introduction because you've already watched the video and the slides are quite clear. We're going to skip over most of the introduction. What I really want to emphasize is that at the end of today, when you leave this session at 1:15, you will understand, first of all, that autism is a spectrum disorder, which I know all of us as professionals or parents know, but that means then in the area of social skills, they're also varied across the spectrum. The second thing is some basic strategies of how to teach social skills. And the third is just really importantly, before you want to kind of address a social skill, does that child have the prerequisite skills to learn that? So those are the three main things that we're trying to cover as fast as possible so that you have a real overview of social skills. We only have an hour, so it's pretty short and you might not get the full depth of it, but I just really wanted to give everyone as much as possible of what we do at EAP. So if you can skip over to slide number 9, I just wanted to mention that, in the video you saw that we work primarily using the ABA approach. Now that does not mean that we don't incorporate picture exchange communication system, we do floor time, we do a lot of fun, interactive play, we focus on fun and building rapport, we do owling as well at EAP. But basically, people either love ABA or they hate ABA, depending on who you've encountered, who your ABA practitioner was, what your experience was. But today I just wanted to explain that really all ABA means is that number 1, you break skills down. Number 2, you provide positive reinforcement. And number 3, you provide sufficient practice. Now this can work with anyone, not just children with autism, but particularly with children with autism, it is extremely effective. I'll just give you an example of how we practice this in our own life. Anybody knows how to drive a car here? Okay, and no one's putting out their hand. I assume everyone knows. Okay, so when you went for your first driving lesson, okay, mine was not very exciting, but he teaches you how to press the gear first, right? And then move to gear 1 and then gear 2. I don't know why they teach us that when we all learn automatic cars anyway. We drive that, but we have to learn that. So that is essentially breaking skills down, right? You didn't go straight, okay, let's go on the road, you're going to start driving. No, he started gear 1 first, gear 2, gear 3, and you had to practice that repeatedly. Then you had to do the reversing, and then the car park, and then the hill, and all of that. Now, that's essentially what breaking skills down means. So if you have a child that you want to get eye contact, but you don't even have the child's interest, so the child is so preoccupied or so focused on the activity that that child is particularly obsessed about, then it's going to be very hard to engage the child to give you the eye contact. So you've got to break it down and actually incorporate the child's interests first in order to get the child's attention, in order to get that eye contact that you're looking for. We have a really good video later that will show about that. Now, the second thing was to provide positive reinforcement. Now, I don't know about your driving teacher, but mine was not positive at all. You were lucky if he didn't scold you or ask you to get out of the car or fire you or something. But ideally, we would like someone to go, hey, good job. Oh, yeah, you pressed the gear really well. Good job. Because that kind of encourages you and motivates you. Obviously, in our Malaysian driving schools, okay, don't expect that. As long as you don't get called bodoh or something, it's good enough. But then you had to do sufficient practice, right? So we had to fulfill, I don't know how many hours, depending on your driving school, you had to fulfill a certain number of hours before you could take the exam. So in the same way, many parents come and see us at EAP and they say, my child can speak, or my child has got eye contact, but it's very brief. He did it last month, and then we never heard it again. Or he does it one time in 2 weeks. Suddenly you will see it, then suddenly it's gone. Because there's not sufficient opportunity to practice. Does that make sense? So then what we got to do is, if we want a child to use the word, let's say open, to open the door to go out of a room, and he has said it before. So you got to set up that opportunity. Practice that regularly so he has the opportunity to use the word open until it becomes something that you're so fluent. I mean, all of us who drive now, none of you have to think, do I have to go to gear 1, gear 2? You know how to drive just like that because it's a fluency. But with our kids with autism or adults with autism, not all of them know those skills automatically. So slide 10 is a repeat because I want you to understand again, that's how we teach children. Slides 11, 12, and 13 essentially talk about each of those skills. Break skills down, provide positive reinforcement, provide sufficient practice. It's just in more detail, and we've written it detailed so that you can read it in your own time so that we can move on to the next slide. Now, we know that autism is a spectrum disorder. I heard that Dr. Ranjini presented an excellent presentation this morning about the DSM-5, so we all have an understanding of the diagnostic criteria and all of that. Now, if we know it's a spectrum disorder, that means that it ranges from maybe very severe, very moderate, or maybe very mild, right? It's a spectrum disorder. So if it's a spectrum disorder like that, that means that you could have a child walk in to this room completely fluent, able to speak English very well, and have autism, and have on this end a child really aggressive or walking back and forth and not many skills, and both have autism. So then, can we employ or apply the same approach for these two kids? No, the expectations for both kids are very different, correct? Because one just may have difficulty with small things like personal space or appropriate things to start talking about, whereas one may be quite destructive or may demonstrate aggressive behaviors. So we have to understand that first, and we have to understand where the child is at in order to decide which skill we need to teach first, and then to actually start applying the appropriate strategies. So at EAP, we usually have a loose definition. I say loose because it's not like you have to fit into one of these categories. But as you see on the screen, you've got the early learner category, the early learner column, you've got the intermediate learner column, and you've got the advanced learner column. Now, the early learner, we've broken, then you see the rows, right? Early learner skills, communication language, play skills, and social skills. Those are only 4 categories of the 7 categories we cover at our center. And you would see that in our video, and we've got a booth if you want to get more information. But let's just look at early learner skills for a start. Now, we coin it CIA, so it's easy for everyone to remember. C stands for cooperation, I stands for imitation, A stands for attention. Now, in this room, whether you realize it or not, all of us are practicing all 3 skills. All of us are cooperating. None of you are screaming and running up and down. When I said, can you clap for my colleagues? You clap for them. When I said, okay, we're going to watch a video, someone played the video. So there's a sense of cooperation here. There's also a sense of imitation, because when you sat down, you kind of noticed, okay, this is what we're supposed to do. Yesterday at the welcome dinner, I had the opportunity to sit with a few people from a different country. And sometimes when you're in different countries, you may not know, okay, which do we eat first, or fine dining, which spoon do we use, which fork do we use. So you watch the person next to you and you go, hopefully they know what they're doing. And then you're using the same spoon, but you're imitating, correct? So we all have to have a sense of the ability to imitate, and then we have to have the ability to attend. So if one of you had a difficulty attending right now, your focus may not be on me, your focus may be on the projector, your focus may be on the colors of the wall, and that's fine. If you like interior design, you might be focused on that. You know, your focus might be somewhere else. So these 3 skills are so critical, and it's impossible to participate in a group environment without those 3 skills. Yet at our early learner phase, if you notice in the box, they have very, very few of these skills. They might have part of it, they might not have. In the intermediate level, we have taught them by this time to be able to cooperate, imitate, and attend in a one-to-one or a small group setting. And in the advanced learner, we expect the child to be able to cooperate, imitate, and attend in a school setting or a group setting. So you can see that it's already divided. So I hope that as we go through the presentation, if you are working with a child with autism, or if you have a child with autism, you start thinking, okay, where is my child at in this area? And one thing I want to clarify, it doesn't mean that if your child is advanced learner, they're all fully advanced learner in all the categories. We just discovered some of our kids that we work with have intermediate levels of language, so they're able to speak in phrases and so on, but their attention is very, very brief, meaning their attention is in the early learner phase. So you've got attention in the early learner phase, but communication in the intermediate phase. Again, it changes your teaching approach or the strategies you're using. So just briefly read through the rest of the columns. Communication and language, the child may be non-verbal or using hand leading. If it's in an intermediate stage, the child is already able to say certain nouns, verbs, and progressively learning language. And advanced learner, the child should be fluent. Play skills as well. Early learners, children, may have very few play skills, may be playing repetitively or inappropriately, whereas intermediate learners may be playing with different toys and can participate in simple preschool games like musical chairs, pass the parcel, you know, those simple birthday games. And advanced learners may be able to participate in play activities or group activities and sports. Now the last one there, social skills, which we're going to go into a lot more, is at the early learner phase, we're very familiar with kids with autism who don't look at you, who just look down and don't pay attention to you, and they might be in the early learner category. But you've also got children in the intermediate learner category who still have autism, but they have eye contact, maybe especially when they're motivated or it's an activity they like. An advanced learner, they may struggle with literal thinking, and they may demonstrate some socially inappropriate behavior. Okay, so let's move on to the next slide. Let me just catch my breath. On the next two slides, we've got social skills for the different learners. Now we've divided, we still have early, intermediate, and advanced, but there are 5 rows of categories of social skills. Now, if you were at the DSM-5 presentation, you would know that the DSM diagnostic criteria has changed, right? It used to be delay in social skills, delay in language, and some repetitive behaviors. Now there's only 2 categories of symptoms, and the first category is the social communication, social interaction, which covers social emotional reciprocity, deficits in nonverbal communicative behaviors, and difficulties developing, maintaining, and understanding relationships. Now, we've chosen 5 rows, but I'm not saying that 5 categories, sorry, though that's not the limit. There's many more social skills needed in areas with play, making friendships, but we didn't have sufficient time and room, so we didn't put them all in. But if we just take a look at the 5 areas, you've got social communication and language. So for an early learner or a child that's in an early learner phase of programming, they are able to maybe start following instructions and requesting. Those would be the basic skills you want. You just want them to cooperate with you, listen to you, and you want them to be able to tell you what they want. Now, by the intermediate learner, you want them to be able to greet you, hi mom, or at least have a way to greet if they can't speak verbally. You want them to be able to respond to conversation questions and respond to statements. Now, by an advanced learner, as all of us know, the expectations are higher for conversation. Right? You need to learn how to interrupt appropriately. You need to know how to stay on topic or how to enter conversations, how to recognize when someone is bored. Because sometimes with our advanced learners, they tend to speak about the same topic that they like a lot, and they might go on, and then we have to really exaggerate, like, I'm so bored. And then they go, oh, are you bored? Yes, I am bored. Can we change the topic? Because you're trying to teach them how to recognize that someone is not interested in what you're talking about, and then how to change the topics. Again, these are just examples, so it's not a conclusive, like full-on list of everything, but it's just something to start thinking about, because maybe you work at a school or at a center and you're trying to teach some of these social skills, and you might realize, hang on a minute, I don't think my child has the skills to learn this. Maybe I need to back up a bit to the intermediate learner, or maybe I need to go back to early learner skills first, and then move back once he's got that skill. Now, the next row is social skills in play. So for an early learner, and we've got some really nice videos we're going to show you shortly, with an early learner child, learning how to build rapport with that child. Now, I know people have different understandings of ABA, and some people think it's very forceful and very rigid. And you'll notice in the video that actually it's not. We try to build rapport using the things that the child likes, following the child's lead, using interests that the child's very interested in. So you want to get that joint attention, you want to get that child to imitate you, you want to have some interactive play like singing Incy Wincy Spider, tickle, squeezes, blanket play, because all of that gets the child's attention, and the child actually is now motivated, the child actually likes you, the child actually even realizes you are alive, because before the child may not even have noticed who you are, or doesn't even care. Now in the intermediate level, by play, you now need the child to learn how to follow the rules of the game, stay with the peer, and also some flexibility. Because we know some of our kids with autism have their way of playing, and it's their way and no other way. So when you introduce another child, that's going to be hard, because the other child's got their way of playing, and so there's supposed to be some flexibility. Now then, with the advanced learner, again, the expectations go up, because now you've got to learn how to enter into play, how to ask people to play, how to explain the game, handling losing, taking other people's ideas. I have a funny story about a boy I worked with. He must have been 8 years old, and he was at an international school, and he loved playing football. So he's at canteen, and he noticed some guys playing football. He didn't realize it's a football match. So he walks into the middle of the football field, takes the football off the field, and walks out thinking he's going to have a round of football himself in the middle of the match, because he just had no idea of the social cues that this was a game, and he almost got beaten up by some year 4s and year 5s because they're like, what are you doing, man? We're in the game. And they maybe almost won, and here he is taking the ball happily, walking off. So he didn't realize that, hang on a minute, he's got to watch the cues, and there's something actually happening here. Now, moving on to the next row, we've got social skills at school. You'd notice like the box is empty for early learner, and that's intentionally empty because we find that if you look back at the first slide, the early learner skills, it's not sufficient for the child to be successful in school. I'm not saying just put the child in school and hopefully he will cope. I'm saying successful, meaning that the child is able to sit like how you're able to sit, or the child's able to play with other kids, or the child's able to follow what the teacher is teaching and actually enjoy the classroom. So we don't find that they have enough skills. But by the intermediate level, the child should be able to follow classroom rules, follow classroom routines, participate in transitions. You know, we have music class, then we have snack time, PE, be able to cope with different teachers. We all know in kindergarten as well, sometimes the teacher is sick, you suddenly have a new teacher, and follow the group. Now the advanced learner at school, it totally changes. And kids at school, we know, can be quite mean at times. And you really need to have a certain amount of skills. With the same boy that I talked about, his friends passed some gas, or kentut as we say, right? And they told him, say it's you, say it's you. And he just said, it's me, because he was so innocent. He said, it's me. And then they all laughed at him, and he also laughed because he thought it's a joke that they're sharing. But we were watching and we're like, I'm gonna kill you. Like, well, not kill you, but like, I'm gonna like scold that boy or something, because you get so mad that someone would bully a child that really doesn't know, you know? But actually you realize they don't understand the jokes, they don't understand when someone is teasing you versus bullying you. So it was quite hard for that child. So even with that whole part about advanced learner, flexibility, then they need to know, when do you tell the teacher? Like, what do you tell the teacher? You can't tell the teacher everything, because then the class hates you, because now you're a tattletale. Yeah, he took my pen, he this, he that. And some kids actually do that because they become like the classroom policemen. One of our kids at snack time, I was saying, why don't you share your food with your friends, or just talk to your friends, you know? Everyone's sharing Cheezels. He just didn't ignore me and kept eating. And then finally he looked at me and he said, don't you know the teacher said no sharing food? Then I was like, but everyone else is sharing. But the teacher said no sharing food. I was like, okay. Then I was like, why don't you just talk to them? Don't you know the teacher said don't talk until you finish your food? So I was like, I didn't get those rules. And I'm like, but no one follows those rules. So he's like, so what, break the rules? So I'm like, yeah. You know, sometimes you got to break the rules. You know, it's so hard to explain to them because they're like, you taught me my whole life to be good. You taught me how to follow the rules. Now you're saying break the rules. What are you, my teacher? So he's looking at me like, what's wrong with you? And I said, look, people are weird, okay? Some rules you have to break, some rules you have to keep. But we really had to talk it through and explain it to him. And eventually he became a bit flexible. But it's just that whole black and white thinking of like, you know, this is how it is. So she said it. I'm not gonna do anything different. So we had to teach that child that. Who are my friends? Handling teasing, handling bullies. So on the next slide, you've got social rules and coping skills. Just understanding and learning what are specific appropriate rules. Again, at the early learner stage, it's just addressing aggressive behaviors. Because if the child is doing these aggressive behaviors, immediately they cut off the opportunity to have friends. Friends, even the youngest kid is not going to like someone who pulls their hair or beats them. Even if it was unintentionally. Another simple example would be to eat food from their own plate and recognize and understand that I don't go in the restaurant and take someone else's food or take my parents' food and then not eating from the floor. Now with an intermediate learner, saying things like please and thank you, apologizing, eating with your mouth closed. With an advanced learner, personal space, telling the truth, handling rejection, negotiation, appropriate behavior in public, empathy for others, and problem solving. I have a funny story about this. I won't mention any names, but yesterday at the dinner, in a private conversation, Datin Rosma mentioned that one of the boys with special needs or with autism was going to take a picture with Datuk Najib, with our Prime Minister, and he obviously socially, you know, he thought, okay, it's a picture, and he put his arm around the Prime Minister like that, and the bodyguards were like, whoa, stop doing that. But again, it's personal space, because for him, he just went, this is how we take pictures, and he didn't realize it's the Prime Minister, so you're just supposed to stand there. It's just really interesting, the amount of social rules that you think about when you work with children like this. It's fascinating because we just take it for granted. I don't know who taught us social rules, but somehow we just learnt it and we just cruise through it. But for our kids, everything needs to be taught, everything needs to be explained and reminded. One of our kids went to a party and he went to the food and he wanted to check if it's to his liking, so he smelt every plate. And his mom had to say, hey, don't do that, it's not cool and it's unacceptable. But he's like, why? I want to know if I'm going to like the food. It makes sense to him. But to everyone else, he's like, why are you smelling all the dishes at the party? Again, it's just social hidden rules, which he just went, I didn't mean to do anything wrong, which he really didn't. But it's just interesting. So the last row is understanding other people's perspective. And this is really important because a lot of our kids with autism don't get that somebody else has got a thought or somebody else is thinking something absolutely different. So in the early learner stage, all we're teaching the child is how to respond to other people and to tolerate limits set by others. So when your parents say, it's finished, we're going home, the child just needs to learn to cooperate with that and say, okay, fine. So it's understanding that person, that, that person is the father and I have to follow that rule. When it's an intermediate learner, it's things like following a point, following an eye gaze. So if someone starts looking out the window, the person is able to look out the window and say, like, what are you looking at? Or, oh, it looks like it's going to rain. And finding out about other people. So I used to practice this with a lot of our kids. We do it at EAP, purposely saying that, oh, I like to drink Coca-Cola. So when I go over to a student's house and he'll say, what do you want to drink? And I say, what do you think I want to drink? And he'll say Milo, because that's his favorite drink. So I'm like, no, my favorite drink, remember? And he's like, Milo. And I'm like, no, it's Coca-Cola. Oh, okay, so you want to drink Coke? And I'm like, yes, I want to drink Coke. So it's really breaking it down and almost making it so obvious and then role-playing it. So the next day I'll come again and I say, I want something to drink. And he's like, Coke. I'm like, yeah, Coke. That's right. So we practice it a few times and he gets it and he has to remember. So the advanced learner, predicting others' emotions, responding to gestures and facial expressions, jokes, humor, sarcasm. So in the end, this boy, the one who everyone made him say that it was him passing gas, not the other boys, in the end, he would ask his friends, when his friends say something like, go kiss the girl or something, he'd look at them and he'd say, you're joking, right? Because he had to learn how to identify jokes, and then they'll be like, oh, you're boring, and they walk off. But he started to understand that they were teasing him or they were making fun of him. Okay, so now that we have an idea of a broad brush of social skills, we need to kind of figure out how do we attempt to teach these skills. Again, with the time that we have, we're going to try to give you some strategies, and hopefully that will help you. So we finished the whole part one. So part one was all about the spectrum and early learner, intermediate, advanced, and the social skills expected for the different levels. Now, in terms of strategies to teach social skills, number one, we need to break skills down. So if a child cannot participate in a one-to-one setting appropriately, we cannot expect that child to perform that behavior we expect of him in a public setting. Does that make sense? So for example, let's say if we want a child to behave appropriately, some of our kids don't mind personal space. So when they walk, they kind of walk like this, and they might accidentally brush someone's bottom, accidentally, totally, not because they mean to, but just because they're just walking and their hands are swinging around. So then if we want them to go to the shopping mall and teach them, okay, don't swing your arms like that and all that, in the shopping mall, there's so much of distractions, there's so much of excitement as well. I don't think he'll be thinking, okay, don't swing my arms. He'll be thinking, wow, Toys R Us, and he'll just be walking and just so excited. So if you practice it in your home setting, in your room, and you can say, okay, when we walk, we got to keep our hands to ourselves, maybe in our pockets, maybe give him a pants with pockets to put it in, and then we walk together. So we practice that in our house, then we practice that maybe just generally around the house. So the child is quite confident, the child is successful. Then we can go to a small community center, maybe not Sunway Pyramid like a big mall, but maybe like a 7-Eleven or a smaller shopping setup, and then practice it there and remind the child before and remind the child after. That's the most successful way for the child not to be embarrassed as well. So you want to communicate expectations clearly. And the way we communicate expectations clearly is usually using some of the following strategies. Now, there's 6 strategies here. We don't teach them all, we don't use all at the same time. But with the advanced learners, we do use a lot of modeling and a lot of demonstration. So like with the boy, let's say, who took the football off the field, I would actually have to practice with him on the field, practicing and learning to watch and demonstrating what I would have done. We use visual rules. I have a simple rule card. You'll see it in the video later. But this rule card is about having a play date with someone. And the first rule is having good words. The second is play with like a big boy or girl. Third is stay with friends. 4 is having expected behaviors. And 5 is have fun. Now, for a rule card like this, which learner do you think this card would be appropriate for? Advanced learners, very good. Because the child needs to be able to learn, to be able to read, and to be able to follow like 4 different expectations, which are quite advanced. Very, very good. Now, for a slightly younger learner, which is C, visual schedules, we would use something like this. Because we want to teach, let's say, play flexibility and how to stay with your friend. So maybe we would have a table time activity, followed by blanket play, which is maybe the child's favorite activity. Then we would follow another table time activity, and then we would put in train tracks. Maybe the child doesn't really like trains, but then you've actually showed the child in advance, look, we're going to play with trains later. And then we're going to have another table time, and then it's jelly balls, which the child really likes, possibly. And then after that, we've got another table time, and then food play. So basically, this schedule, because remember my second point, communicate the expectations clearly. So who could benefit from a board like this? Early learner, even intermediate learner. So a young child, a child with not much skill, you can just show them. Now, a question many people ask us, what if they're not looking at the board? That's okay as well, because chances are sometimes they just glance at it from the side, but the main thing is you want to follow through with the board. And if you do this constantly and regularly, the child understands pretty quickly. Now, for some kids, let's say if they have a visual impairment, or they can't really see very clearly, you might want to make the pictures bigger. If they have a fine motor difficulty, they can't pick up the card, you want to make the card thicker or put it on some kind of a sponge, or some people put it on bottle caps or something like that. The next one is social stories. So we have an example of a social story here. It's very, very easy to make, but a social story essentially tells kids what is expected of them. You can make it for early learners, you can make it for intermediate learners, you can make it for advanced learners. The founder of Social Stories, her name is Carol Gray. You can Google her, you can even buy her resources. We have some samples on our blog and website of different social stories that we've made. But this book particularly is called It's Okay to Lose, and we will show you in a video of how to use a book like this, because we're trying to teach the child that it's okay to lose, it's no big deal. Now, the next one is called video modeling, which is where we act as the child to show them very clearly this is what is expected of you. Again, you can do it for very simple things. For example, okay, the toy is almost finished. 5, 4, 3, 2, 1, take back the toy. And the other teacher, so let's say me and my partner are practicing this, the other teacher goes, okay, and puts it away. So the child understands, oh, okay, when you count 5, 4, 3, 2, 1, I'm going to give you back the item. Now, whether he chooses to follow it or not, that's a different case, but at least you've communicated the expectation very clearly. We will show you an example of a video very shortly, and the last one is to role play. So once you have watched the video, now we're going to practice it. So especially with our kids who are on the advanced learner stage, we had to really practice this. I had a young girl that really had a difficulty with thinking the right thoughts and saying the right thoughts. So for example, if I cut my hair, she really didn't like, because she had quite a lot of inflexibility, she really didn't like girls to have short hair, because girls had to have long hair and girls had to like pink. And that was just the rule. So when I said I like green, she would say, I hate you. And then she would look down. Then I was like, okay. I said, it's just no big deal. I like green. But no, girls cannot like green. Girls only like pink. So then I was like, okay, so we put in this program, say it, think it. And so I purposely went and cut my hair and had like some bangs, which she really didn't like. And so we practiced it beforehand. And I said, look, you know, when I come in, you try and say something nice to me. And you can think. And we used a picture and everything, what you think. You can think, wow, Joe looks really ugly. You can think that, but you don't say that. What you say is something like nice t-shirt or something. So I come into the room and she did very well. She looked at me, she looked at my hand, she looked down, and then she went, nice t-shirt, and she walked away. So we also then practiced with me pretending to be very fat, because she would say things about people's weight or people's skin color or people's body odor, which she really didn't mean to, but she just had to say something. So I put a big pillow in my stomach and pretended that I really put on a lot of weight, and I walked into the room, and we used to practice this frequently, and she would just look at me and she'll say, wow. She'll just look at me and go, wow, okay, because she was looking at my huge stomach now, and I've looked so, and she goes, nice to see you. And she just walks away, and we would reward her with so much of praise and cheer her on, because I knew it was so hard for her to not say what she wanted to say and to keep it in here and to just say something different. So we would praise her, reward her, take her out, for a shopping trip or something, do her nails, just because she did so well. We'd high five and so on. So then we used to practice with this girl also handling bullies, because people would come up to her and say, oh, you're so ugly, you're so fat, you're so this, and she would get really upset and she'd say, no, I'm not. And then she'd start to hit them, and she'd get really escalated in her upsetness. So we had to practice it. And when I say practice, I mean, I had to write a story first and explain to her that I was going to be the bully, because if I didn't want her to hate me. And then I had to say, look, you're so fat. And then we had to teach her to walk away. And so she would go, I don't care, whatever. And so we taught her the whatever kind of thing. And so I used to teach her, you just go whatever and you walk away. And so she did. She'd look at me and she'd go, whatever. And so that was level 1. And then level 2 was, I'm telling the teacher. And I said, if they continue, level 3 is you go and tell the teacher. So we practiced this and practiced this and practiced this until she got it in school, and then until she stopped that. But that's really what our kids need, right? They need us to coach them. We are their teachers, but we're also their coaches, saying, yeah, you can do it, you can do it. And if you can't get it yet, how can we make it easier so you can get it? How can we practice it more so you can get it? What am I doing that I'm missing out, or what is the missing key to get you to understand what I'm trying to get you to do? So that really helps with our own frustration as well, because it's really like a puzzle almost. It's really like troubleshooting, and that's why we work great. I really appreciate having a team, because every time we get stuck, we come back together and we're like, okay, this didn't work, what else can we do? What else haven't we done yet? Okay, so let's go to some quick videos. The first one that Emma's going to pull up is of an early learner child. And if you refer back to your slide 15, expectations of an early learner child with early learner playfield.
Shannon lies over the ocean. My Shannon lies over the sea. My Shannon lies over the ocean. Hey, I see your feet. Oh, bring back my Shannon to me. Bring back. Oh, bring back my Shannon to me. Bring back. Oh, bring back my Shannon to me. I got to make it. You feeling cold without the blanket? Feeling cold? Okay, you can have the blanket.
Awesome. So that's a really good example of, if you notice at the beginning, the little girl was not really wanting to play. In fact, the girl was moving away. And what our supervisor did, Emma, is instead of like forcing her or pulling her out of the blanket, out of the tent, she just started to sing very gently, kind of play with her a little bit with the blanket. And by the end of it, did you notice that you got eye contact from her? And also she managed to get joint attention, where now both of their focus was on the blanket together. Whereas before, the little girl was really not interested, and she was kind of just leave me alone, and very similar to what we all notice with kids with autism. So just that whole approach and engaging the little girl to actually play together is what we would suggest you do a lot to build early learner social skills. So a lot of following their lead, a lot of enticing and playing and being interactive and gentle and not so forceful. And we find that kids don't really like a very physical, aggressive kind of approach unless they like rough play and all that. But I think if you are just meeting a child for the first time, that's not a good approach, because you need to build trust, you need to build rapport. Okay, on the second video, this is an example of a video model. Some of our team at EAP made this video, and it's actually a video of how to play hide and seek. So we'll just watch that quickly.
Hi guys, today we are going to play hide and seek. Remember, there is the hider. The hider needs to hide. And there is the seeker. The seeker needs to seek. Alright, let's play hide and seek. Seeker needs to count 1 to 10.
1, 2,
Hider, go hide.
3, no peeping. 4, 5, 6, 7, 8, 9, 10. Ready or not? Here I come. Is she under the table? No, she's not under the table. Is she behind the board? No, she's not behind the board. Wait, I see something. Is she in the toilet? I found her! Wow!
Alright guys, that's how we play hide and seek.
Okay, so that's a pretty simple video. You can see, I mean, there's a lot of exaggeration, like, okay, I'm gonna hide. Like, it's very exaggerated so the child is paying attention, and then like, even the part where the seeker goes, not under here, it's again exaggerated because you want the child to engage. Now, of course, oftentimes our little kids will start to do that too. Is she here? Not under here, not under here. And they copy exactly what we do in the video. So then you may not be able to play that video repeatedly because if not, that's how they think you play hide and seek. So you want to then change the video and make it a little bit more complex. Now, that's not the simplest version of a video model. You can make it even simpler. So let's say, for example, if you go back to your center or your organization and you try something like that, but it doesn't really work, you just need to think about whether the child has sufficient understanding and attention to follow that sort of a video. Sometimes with our kids who are younger or who have less skills, we use a visual, like the hider will wear a hat, or the seeker will wear a hat, or we teach the child just to hide for the first step so they really understand how to do the act of hiding first and then the act of seeking, so it's not confusing. So in terms of breaking skills down, you can break it down a lot more than that video. But now we're just going to go to a video of where this video model is incorporated and how we did the role play.
Let's see how they play hide and seek.
Hi guys, today we are going to play hide and seek. Remember, there is the hider. The hider needs to hide. And there is the seeker. The seeker needs to seek. Alright, let's play hide and seek.
Hey, Mike. Okay, so I'm gonna count, alright? I'm gonna count to 10. 1, 2, no pee-pee. 4, pee-pee. 5, 6, 7, 8, 9, 10. Ready or not? Here I come. I can hear some noise. I think I found Ryan. There you are! I found you! Wow, that's really nice playing hide and seek. Let's play a game.
So later on you find you have to teach them how to actually win. So you have to actually be really quiet and how to hide in less obvious places. Because initially you just want to teach the basic game. Then as kids get older, they really play hide and seek in a way where they don't want to be found. And so you got to teach them that a bit more. Okay, the last video, because of confidentiality and privacy, we couldn't get one of our advanced learners or teenagers to participate in the video. So we've actually got a therapist acting as the child. So we've got Ziwei, who's in the blue, and Sarah, who's in the black. Sarah is the therapist. Ziwei is pretending to be the child. And this is how we would use a social story that I talked about and a rule card that I mentioned earlier.
Let's play a game, but first, let's read a social story. It's okay to lose. I am Ziwei and I love playing games. Playing games is so fun. Sometimes when I play, I will win and I will lose. But it's no big deal. When I win, I can say, yay, I win. You can say hooray and you can clap. When I lose, I can say good job to others, ask for another round using good words, and I can be a good sport. It's okay to lose. It's no big deal winning or losing. Okay, let's go through the rules card. Number 1, you can have good words. Number 2, you can play like a big girl. Number 3, you can stay with friends. Number 4, have expected behaviors. And number 5, you can have fun. Okay, let's play Snap. Okay, I'm gonna go first. Wow, good job playing like a big girl. Hey, good work staying with friends. Oh, Snap! Oh no, I lose. Can I have another round, please? Yeah, sure. Hey, Ziwei, nice job having good works. If you want to take over here, you've been having expected behaviors. And hey, did you have fun? Yeah. Awesome. Okay.
I think they're a bit shy. So with that at the end, the girl would have gotten a prize or a reward or maybe tokens to go and get her favorite DVD or something. The other thing about that video is you notice like to handle losing, we got to teach the child phrases that the child can use or coping phrases. So if you're losing, not all of us lose well. So, what could you say? Like, okay, fine, I'll try better next time. Can we play again? So they had to actually practice that. And then remember we talk about breaking skills down. So they would practice with an activity that the child is not so intense to win. So let's say if the child really has to win football, you start with something like memory game, which the child doesn't really bother if I lose or win. So again, you're going from easy to medium to slightly harder expectations. Okay, so those are the videos. Now the next slide, again to continue teaching social skills, that's on slide 18. You decide on the specific goal you're trying to teach. You break it down into individual goals. Try not to teach 2 skills at once. So for example, if you're trying to teach a child to take turns, don't force the child to look at you at the same time and get eye contact because you might frustrate the child. Prioritize and teach the primary skill first. Think about what the child should not be doing or what should the child be doing. So if the child is busy, distracted with something else, let's say the child's on the iPad and you're trying to play this handling losing game or teach something, you want to actually remove the distraction of the iPad first and then say, let's do this first, and then come back to the iPad. In order to determine the teaching strategies, you want to incorporate interests and make it reinforcing at the same time. You want to teach the specific skill in a very structured visual format. How can I teach the child exactly what he needs to do? Now, one of our kids, which actually Nisha works with, she came up with this good idea where we have a child that likes to look at girls' private parts. Or just like kind of stare. And it's very inappropriate. The child is already like a teenager. And it's very, very inappropriate. So what she developed with the team is they actually had a body, like a whole body, and then there was the red zone. So these are the red zones where you don't look and you don't touch. And then the green zones like the head and the legs. And I remember meeting him after he was being coached on this. So they did it all in 2D pictures first. So very structured, very visual, and then they would practice one-on-one, and then they would practice with a few more girls, and then our center is full of girls, as you can see from all the teachers and therapists, so we bring him to the center, so it's getting a bit harder. But I remember when I met him, after that whole training, he would look at me like this, because he was really, I think, focusing up here, and I was like, good looking. Like, because he was really like looking up here, and he was trying his best not to look at anything else. So you want to reward that, you want to coach him. But again, we didn't push him into the hard environment where there were so many girls, so much of distraction, and then force him and then start scolding him or something. We never did that. Made it very easy for him, made it very visual for him, taught him exactly what's expected of him, and then practiced it more and more. Now, the next one would be what's motivating the child. How can I reinforce the new skill? What are the strengths and difficulties? Which learner phase? And how do you generalize to other situations or real life situations? Now then you implement the strategies, you practice it as much as you can. You set up the situations in real life as much as you can. We do a lot of practice sessions, going to the barber shop, going to practice, going to the shopping malls. You prompt in the situations and then you fade out the prompts. And then you evaluate real life situations. So you get feedback from the parents. When this child went to the next party, did he smell the food? When this child went to the shopping mall, did he touch people accidentally? So you want to really determine if more practice is needed. So that's all about the overview of teaching social skills. Now in the last 5 minutes, just some important points would be the prerequisite skills. Now I was just thinking about it today because like I mentioned, I'm pregnant and soon I'll have a newborn baby. Now, I understand that obviously you need to feed breast milk first, and then there's a progression from that to formula milk, to soft solids, and then to foods. So we understand that so well when it comes to developmental milestones. When it comes to typical children, we know, okay, at 5 years old or 4 years old, they go to preschool. It's very clear for us to follow. So I was just thinking to myself, we never put our children in a situation where, okay, you're an infant, let's try French fries, see if you can try it, see if you can eat it or not. You don't, because you know the child doesn't have the teeth to do it and the stomach can't take it. So in the same way, when we put our child to school, we go to standard 1, we don't say, hey, do you think he'll do better in form 1? Because you know he's only 6 or 7, of course he's not going to do better in form 1. He needs to start standard 1, then standard 2, then standard 3, and then go up. But sometimes when we teach our special needs children or children with autism, we don't think, because there's no clear guideline like a developmental milestone or something to follow, we don't think, do they have the sufficient skills to be at this level that we're trying to put them into? So for example, when we screen kids at our center, we have kids who come in with very, very little skills. They're playing in a corner all by themselves, no cooperation, no imitation, no attention. And for some reason, these parents have been advised that they should put the child in a kindergarten or put the child into a school environment and that the child will learn. So then I think to myself, again, it's that situation of why would you put your child in that environment when you know it's going to be so hard? Because remember I said, if you can't cooperate in a one-to-one setting, you put the child in an environment where there's so much of distraction, so much of sensory input, so many kids, the teacher can't give you that much focus. It's not very easy. Now I understand some of us don't have choices, and some of the facilities we have, there's no other options. But it's just really, really crucial as teachers, as family members, as parents, we have to think, does my child have the prerequisite skill to be successful at the skill I'm trying to teach? So is the child able to cooperate, imitate, attend? Does the child have a variety of interests? So for example, you want to do a play date. Is the child able to cooperate with someone else? Is the child able to participate with someone else? Does the child have other play interests, or is the child only interested in his activity? Does the child have any aggressive behaviors that need to be addressed before introducing the child to a peer or a group environment where then he can get socially isolated? Does the child have the receptive understanding to learn what you're trying to teach? Does the child have the ability to communicate functionally? So I've put that there. But we've also got the 3 tables earlier, right? Which you can refer to. So now if you're trying to teach your child something or an activity, you can just make reference to those earlier tables and see, does your child or the student you're teaching have those prerequisite skills to be successful learning this current skill you're trying to teach? So in summary, we've talked about 3 areas. One is you want to identify what type of learner your child is currently at. You want to identify the level of social skills that the child has. You want to employ specific strategies that break the skills down, which we just covered in part 2. And in part 3, you want to ensure that the child has the appropriate strategies to learn these skills, so the prerequisite skills. So that's in summary. The next slides, we have there was supposed to be time for questions, which if you want to stay back, I'm here, absolutely willing to answer any of your questions. I just don't know if they're going to use the hall for something else. But then there's also our references. And just on the last slide, we just wanted to invite you to join us. We've got a Welcome to Hope hashtag campaign on Facebook and on Instagram. It's actually quite interesting. We've got quite a lot of interesting posts. People have put up videos and so on. And the person that has the most likes has the opportunity to win a mini iPad. And then on the 24th of May, we only have about less than 100 places. So we have a workshop called Real Life, Real Difference. We're flying in Dr. Nan, who has great experience from our parent company, Wisconsin Early Autism Project. She's going to be talking about sleep and parental involvement, and the tickets are only 90 ringgit, right? So if you want to sign up, you want to try and sign up at the booth today because, like I said, we've only got less than 100 spots. And then you can save the date for 8th November. We have an EAP conference, and the topic will be with Dr. Perrin, again from Wisconsin Early Autism Project, called Functional Analysis of Behavior. So I think that's about it from me. I finished just a few minutes before time. Thank you very much, everyone. Thank you so much.
Thank you, Joe. Okay, like I said before, there will be no Q&A session, but Joe will be happy to stay and entertain some of your questions. With that, I thank everybody for 110 attention to the speaker.
Yeah.
And on the behalf of the organizing committee, I would like to thank Ms. Jochebed Isaac for sharing a 3-hour talk in less than an hour on a wonderful topic of social skills. Thank you very much.
Thank you very much.
Okay, we can go for lunch now.
Hi, yeah, sure.
Wait, sit down.